What if I told you that there is one thing in dentistry that is accessible to every dentist, but only 10% of dental practices are taking advantage of, but has the ability to completely transform their business and the lives of their patients? No, it's not Botox. I'm talking about medical billing. And here's why. Over 60 million Americans suffer from conditions and disorders that are considered medically necessary and are treated by a dentist. So these procedures and services include sleep apnea, TMJ, bone grafts, full arch implants, CBCTs, accident cases, and more. So as you can see, being able to tap into these medical benefits to provide access to care for these services, for these patients, is extremely powerful and rewarding for not only the practice, but for the patients themselves. It can increase case acceptance, set the practice apart, provide additional value, and increase referrals for the dentist. So why aren't more dental practices medical billing? It seems like such a win-win, right? Well, the issue is, it's not that it's difficult, it's just different. And dental practices aren't set up for those systems to account for those differences. So what happens is, the dental practice begins to incorporate medical billing using their dental systems, and they get frustrated because of those differences aren't accounted for. These frustrations lead to lower confidence, and they'll quickly give up and not fully implement it. A good example of this is my girlfriend, Faith. Her dad needed emergency medical care and went to an out-of-network provider. Faith called the insurance company, checking on the medical benefits, and they had great benefits. She called the insurance company, but she didn't know the lingo. She didn't know the language of how to speak and check for the benefits and how to navigate that phone call. And the insurance company laughed in her face and hung up. And that's the experience a lot of dental practices have as well. Well, luckily for us, my mom happens to be Jon Nierman, who is the guru and OG of medical billing in dentistry. So she called the insurance company back, and she navigated that entire phone call. I still don't know what she did, but the next day, Faith's dad's credit card for $11,000 was refunded, and the insurance company covered the entire thing. Now, how powerful is that? What an impact that made for Faith's dad. And every single dental practice has the capability to do the same thing for so many patients in need of medically necessary care: sleep apnea, TMJ disorders, chronic pain, headaches, full arch implants, all sorts of procedures that these patients need. How powerful can that be? So what are some other differences between dental and medical that will help dental practices understand how to incorporate it? Well, the big thing is the codes, right? You have a different set of codes. So for medical billing, you have your ICD diagnosis codes, and you have your CPT procedure codes. The procedure codes are the ones you get paid on, and your diagnosis codes are the condition and the symptoms of the patient, the diagnosis. Now, for dental, there's not too many ICD diagnosis codes that you need to remember. Those are your sleep apnea codes, your dysfunction, your TMD codes. But as Rose says, there's a code for everything. There's a code for that. And for ICD codes, there's even a code for problems in relationship with your in-laws. As she says, there's a code for that. We're still not sure what that one's for, but once you know the codes, that's step number one. And you can just call the insurance company, do a simple phone call, and check the benefits, provide the codes, and they'll tell you if it's covered under the patient's plan, and some other key information about the patient's insurance policy, what their deductible is, if they have out-of-network benefits, if there's a pre-authorization needed. That's all really important information. So what else is important? What else do you need that's different? Well, you need your documentation, and this is a big one. You've heard in real estate, location, location, location. Well, another one of our sayings is in medical billing, it's documentation, 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 because it's that important. And that's really all it is building that case of medical necessity. And that starts with just asking the patient the right questions, providing them an intake questionnaire that's gathering information about their chief complaints. Why do they need this treatment? Why is it medically necessary? And you're building your case of medical necessity as you go, before they even come to the office. And when they do come in, you document that exam, and now you have all of your documentation that shows why this care was needed. You have that, and you have your codes, and you're good to go. Now, we call the SOAP reports, that's our common form of documentation, the golden ticket to reimbursement. And that's what most practices are missing, because they're writing their notes in dental terminology, and then it gets denied, and they don't know why. It's all about building a case of medical necessity. And that's really all there is to it. And incorporating those two things can make the world of difference and stop all that frustration and stress and start being able to successfully implement medical billing and do those rewarding great things for your patients and growing the practice. I have a friend that's a dentist in Virginia that just started a new practice from scratch just last year. And he wanted to offer these rewarding services like sleep apnea treatment, TMD, full arch implant cases. And he knew he needed to set himself apart. This was a brand new practice. And he knew he needed to begin billing medical insurance. And once he started doing that, he quickly was able to increase case acceptance for his patients and really start scaling his new practice, where a year later, he's now one of the premier practices in Virginia offering these services. And his patients love him for what he's able to do for them. And every dentist can do the same thing. It's really amazing. Another thing, patients are starting to pick up on this too. And now patients are calling and asking dental offices, hey, do you bill medical insurance? And they're making decisions based off providers that will tap into those medical benefits. And what we're predicting is in the next 5 years, the dental practices that are not offering medical billing are going to be the ones that are left behind. So now is the time to begin billing medical. And if you're in dentistry, there's no time like the present, as it's no longer a nicety, but is now a necessity. Thank you very much.